I see us live. Hey everyone.
Hello. Cool. So we're ready to go? Good. Hi. Well, thank you everybody for being here. Today's day 4. Actually, day 4, right? And today is June the 4th. That's very cool.
Mhm.
It's actually my dad's birthday today. So
Oh
I'm
wow.
celebrating. Yeah.
Yes.
So, okay. Today, today the topic it will be more around the lines like it's tricky.
Well, some of the things we can talk about. Uh, it's the migraine. I love that you brought that to the table, Mariana, from your own experience. So for anybody who is um, had any sort of headache or migraine experiences, um, you will definitely benefit from this topic today. Hey Lois, good morning. I love that Lois, you have us on your calendars. You're like, there they are. Boom.
Yes. Hi. Thank you
um,
for being here.
yes. So Lois, let us know if you've also experienced migraine headaches, if that was one of the things. Hey Laurie. Um, and then we will also talk about some
Hi.
additional information as it comes up. So Marianne, I'd love for you to share your journey in this between yesterday and today, what happened, and show us very practically how you walk your talk.
Yeah, yeah, it looks like it. I'm glad. So the thing is that I spent most of the night with a migraine yesterday and today when I went to work, and I I was aware yesterday that I needed to do certain things, which is related to the things we talk on day 2. And there I was having to do my own thing. So I mean, first point that most people think we doctors we don't get sick. Well, that's a lie. Of course, we get sick. We're like everybody else, and we forget things too. So I had a migraine. I was, feeling this usual half side of the head kind of pain in, that it can be pinching even through the eye. So I knew I needed some rest. I had plenty of good food that I knew would soothe my stomach because I knew there was also some of that. Uh, a little bit of everything. The lack of sleep that I had from the night before. Then yesterday I was trying to catch up with my water, so it was still there. But it took probably 24 hours because it's now, one day later since our last talk exactly. And now I'm feeling, much better after I had to take a nap yesterday and a nap today after work. I started catching up with the water and the sleep yesterday, and it wouldn't I mean, the body would be quick enough to respond to the changes that I was making, but still a few hours. And even there, the body is so wonderful because it took all these little things that I was aware as I was going and thinking. Even talking here was making me aware of the things that I had to be reminded of. And then boom, all is well. But you have to take the action. I had to take the action. I had to go through the migraine. I even woke up at 2 in the morning and I thought, I didn't have taken a pill because I don't like taking pills. I'm a doctor who don't like pills. I'm the anti-pill doctor as much as possible. So I took the pill. I put something really soft in my stomach because I noticed there was some of that as well happening. And then I woke up at 6:30 ready, to go to work because I was afraid that I was not going to be on a good state to go to work. But I managed. So in like maybe 4 hours between 2 and 6 in the morning, I felt so much better. So I went there, I did my day very calmly, very aware that I was not going to stress, about the day job or the workload. And it made such a difference. So I'm like, okay, reminders, like for me and for everybody. And the same advice that I am giving here, I was giving to my patients all day through the consult. And it's like always, we have all these signs coming from all different places all through the day. And it's
Yeah.
really, really amazing. 24 hours or less is what it takes for the body to reply, to your changes. And then you feel just good.
I love that. And I love that as a challenge too for all of you watching this live or catching the replay. Like, what is your body asking and saying to you for you to tweak? And how can you do the exact things it's really like I told Mariana, it's like tiny tweaks, right? That's my terminology that I like to use. But Mariana
Yeah.
also does these tiny tweaks where she shows you if you change this a little bit and change this a little bit and change this a little bit, that
Mm-hmm.
big mounting of a problem that you're facing dissipates, right?
Yeah.
So it's in doing that and then trusting that you get to see the shift practically in your own body within 24 hours. That's amazing, right?
Yeah.
And of course,
Yeah.
we can even shorten that time even more if we wanted to. But 24 hours is a good average time frame where we all get to look at this and play with the concept of it and lean into health and wellness in this way, right?
Yeah, to get started,
So
because it doesn't take, 7 years of medicine for you to be able to see those things. If you are taught these things as simple and basic and easy as they are, then you can give this tool to everybody. Actually, I've been thinking, oh my God, even this, I mean, if the people here, if you who are listening, you have kids at home or grandkids, you can take this information, you can teach them, you can show them. I mean, if you go through it on your experience, you will know it works and you will know how. So it will be easier for you to give that information to the kids. And oh my God, if we can teach kids awareness, that which is the main goal. I mean, for me personally, going straight into the kids' knowledge, oh, that's perfect, and it's possible. It's totally possible.
I love that because you don't know this. I didn't tell you it, but it's exactly what I did this morning. Of course, right? I got the memo from you. So what I did was I grabbed my older daughter's phone and I'm like, okay, let me help you show you how to do this stuff. So I found an app which tracks your habits, you know. So the habit tracker, whatever software, I picked one and installed it on
Yeah.
her phone. And I said, okay, here's the thing. You get to put whatever you want to track, and you can have fun in seeing that you got it done. And so she's like, okay, and she's wondering why I'm giving this to her. And then I start the conversation. Well, you know, the basic things about sleeping and eating and so on. You can
Yeah, I
put it
love it.
here, right? And you get to see like your own progress, or if it is that you're, you know, like sometimes we forget in all our busyness or whatever else we're doing, right? And you get to see where it slipped a little bit. And I know you mentioned this earlier in this conversation as well, where you talk about like catching up, right? Um, I find if it is that we see ourselves catching up a little too often, then we need to actually tweak when we're doing those things. So, for
Yeah, to avoid
instance,
anxiety.
right, for instance, somebody might be better at executing one of the habits at night. I might be better at doing it in the morning. So, like,
Mm-hmm.
choose your time within the day that is you're most likely to be successful if you
Yeah.
to execute that habit rather than you push yourself and force yourself to do it because I have to. I want this and I have to do this and I need to drink 8 glasses of water. So, you know, you make it
Mm-hmm.
hard on yourself. That's not fun. That's not the point of this whole conversation. So, where is it that
Mm-hmm.
you can put in those beautiful timing pieces within your 24 hours so that you can have the best benefit of these habits, yet it will feel very much like an optimum energy. It will feel like natural, like breathing, like a flow, and you get to benefit from it without even the pressure of, oh, I have to do these things.
Yeah, yeah, and the beauty of this is so perfect because it goes to day one and day two when we were talking about the health journal. If we write these things down, eventually we will see the pattern in ourselves. It's about getting to know your own body. I mean, I can tell you all the tips, but only you can put them into practice to see how it works for you. So it's so perfect, while you were talking, I had the example coming to my mind of how, you know, a newborn for the first year, they are completely vulnerable. They just depend on you, and you are constantly watching what things for the baby: the food, the sleep, the poop, and of course the play. Play basically
Yes,
means that they are stretching, that they have to,
exercise,
you know, they're exactly their I forgot the word in English. How do you say the
the
mm,
muscles. What?
muscles, motor?
Oh, the
There's a
motor
word for
motor
it.
muscles. Yeah, the I know the motor muscles we would say, or the motor movement, and
Motricity?
I'm
I
not
don't
sure
know
if
if
that's
that's a
it.
word. Well, there's a term for it. I'll bring it afterwards for everybody. So the first year of a baby, or the first few months, it's all about the basic things. What better example than that? Parents are monitoring that for the baby. The pediatrician is also monitoring those basic things for the baby, because those are the basic things for everybody. Eventually, life, you know, put more layers on us, and it's good, but it's as simple, as clear as that. You know, what does a newborn need? Food,
Yes,
milk,
lots of
fluids,
saying motor skills, motor skills. Yeah,
motor skills. Yeah, yeah. I have the words in Spanish, but I will search them actually, because they're super important. So I'll bring them on the
yes.
comment. Thank you.
And I absolutely love that reminder, because it's such, like you said, it's so clear when we see it through those lens, right? As a baby, this was what we're doing for our kids. This is what our parents were doing for us. Of course, just rather than stop, just continue that monitoring in a
Yeah,
very
and teach them.
gentle way, and also live the life that you're living with all the things that you're also doing and creating and
Mm-hmm.
responding to, right?
Yeah,
And you get to
reminds me
fine
of the
tune.
times I used to work also with the elderly people. Same, exact same. For so many years, I was working in pain medicine with elderly people, and it was basic hydration, sleep, physiotherapy for their joints. You know,
Mhm,
same, all through life.
mhm, mhm. Yeah, and that's beautiful. So, so you might be listening to this and wondering, well, if it's so basic and all of that, like, w- this is one of the questions I'm hearing. Like, why would I engage with Mariana then if we can all figure this out? So it's true that yes, we can figure out certain things, but in my perspective, I see for you, Mariana, being that anchor where I can be like, okay, I know I'm supposed to drink water. I know I'm doing it this way. But somehow when I'm doing it, these are the glitches that I'm experiencing. It's not quite right. You want to aim for the Goldilocks effect, right? That's how I like to call it, where it's like just right. It's
Mm.
not too big, it's not too small, it's not too hard, whatever. It's the Goldilocks effect. And so because of that, you need it to be specifically to you, uniquely to your body, to your lifestyle, to your other habits,
Exactly.
to your the other external stimuli or people around you, whatever's happening, because all of that is impacting you. So you have
Absolutely.
all these other factors, right? That if this was supposed to be a chemistry experiment, it will not yield the same results, even though we're using the same, uh, chemicals or ingredients or methods.
Yeah.
And that's why having a conversation with you, Mariana, is so important. It also depends on the fact that if somebody is already experiencing certain conditions in their body, so they already have health related issues, their whatever pain management things they might be doing, and all these other things, it's already putting the body a bit in a limbo, a state of limbo. And here it is that you get to be like, okay, yes, we this is a preventative method, but because you have XYZ, do it this way instead, or just apply 1% of this
Yeah.
there so that it really helps with this first, and then we can do it this way. And we all need that level of precision. And I'm happy that you've spent not only your years over in studying your medical field, but you've also spent all the other hours uh, fine tuning, like, okay, this is what the medical practice looks like and this is what it looks like in the other lenses, and how, if I combine this and that, what happens. So you
Yeah.
have invested
Mhm.
your entire life to this kind of journey. And so if I wanted to do it, yes, I can take your path and invest all that time and energy as well. Or I can simply ask you, because in my case, what's passionate for you is not my zone of passion and genius,
Exactly.
right? So you get to show up in my life to hold that position for me, and I get to ask you as the expert in the room. So I absolutely
Mhm.
love that you're coming here and being very open and transparent for everybody,
Mhm.
and we
Thank you.
all get to benefit from this, and to ask the questions now. And then also, I know because of this, you can create the spaces if somebody needs a personalized consultation instead, and a one-on-one interactive call, rather than, sometimes we don't want to say everything in the public chat or whatever
Yeah,
else is
yeah,
happening, you know. Uh,
absolutely. And it's the
yeah,
reassurance as well, because as you said, why would I need Mariana if she's teaching me all these things, or any other person in this position of guidance? But that's precisely it. We all need a guidance. We all need to someone to grab our hands in certain process until we can actually fully learn and understand, so we can take it on, our own into action. And to me, it's reassurance. If we feel reassured in that sense, then we will be confident. We will gain the confidence to do it, and to then trespass that knowledge to our kids, or in the people in our household. And definitely it is required, because then you wouldn't know if you're doing it right, and then there's all these doubts, and then it's it's incredible how the mind works, because it's about this process, basically.
yeah, yeah. And one of the other things that was crossing my mind in all of this is, well, how do you know if you need Mariana? Well, are you in optimal health and wealth in that process? Because a healthy body means, you're alive and you can bring in the business and you can do all the things. If your health is not in order, they say your wealth, there's no wealth, even though you have that, right?
Yeah,
Because
without
your
health.
money, yes, your money gets spent in investing to try to bring your health up to standards again. So that quick self-assessment of checking in, are you really happy with the state of your health and your well-being, right? Is there room for improvement? If that, if their answer is yes, there's room for improvement, I think it's a great
Then,
space
yeah.
to start with Mariana, right? If it is that, if it is that, what, like, whatever it is, it's not like, oh, we've reached that cap and I get to stay there, because our lives were always evolving and changing. And so sometimes a certain area of our life will be beautiful, but then when we shift into another level of our, stage of life, or whatever we're creating, sometimes
New
something
challenges.
drops, right? Yeah, and then
Hmm.
you're like, I thought I had this all figured out, what's happening here.
Yeah,
So
back
I'm
again.
really, yeah, I'm really happy that you get to be, the doctor who is a click away, and somebody that we can completely trust and lean into, to
Yeah, that's
saying all the
it.
things without feeling like we need to censor ourselves or anything like that. Like, I can bring everything on
Yeah.
the table and say, okay, I don't know what the answer is, but from my vantage point, this is what happened, this is how I'm feeling, this is what I think might be true, this is what I've been doing to resolve it on my own. What did I miss? Right?
Yeah, and there's so much more in the picture, because then it's when we have all this information, that I'm sure it's the same for you in your field. You keep getting things from everything and everywhere that you have learned. So you bring something here and here. Every time you're talking with someone, you keep pulling it different tools from what you know, and to be able to
Yes.
do that in one space for one person alone, with all the tools that I have from medicine, from Ayurveda, from everything, is just like, it's fulfilling, it really is fulfilling. And I'm sure everybody watching, they can relate with that feeling on in their own work, right?
Yes.
Because it applies to everything, basically. It's all
Yes.
connected. That's the beauty.
So thank you, Lois. You're saying support is so important. Yes, definitely. Right? Because we can
Yeah,
only take ourselves so far, but if you have an expert in the room, you get so much more, right? In your health, in your
yeah,
everything, whatever choice you're making. So that's really beautiful.
yeah.
And so Mariana, do tell us about this telemedicine concept that's been happening. I'd love for you to say something about that before we wrap up today's call.
Cool. Yeah. Yeah, it's well, it's interesting. I was reading about telemedicine today. A colleague mentioned it the other day, so we were talking about it. I was searching about it because I'm familiar with the term in a way. Basically, telemedicine is it's doing this like an online consultation. Of course, it applies to certain things, but it's pretty much so many. I mean, like there's so many things that can be talked through telemedicine, right? So, through an online consultation. So there is this because of coronavirus, and probably before that, there's been all these proof that these things can be done, right? Because even I have been working a little bit in telemedicine from my day job these days because of what's happening, and it has proven everyone, that telemedicine can be an actual thing. So I was just amazed because I've been trying to basically do that in the last 5 years, and when I was doing that, I remember 5 years ago, people would go like, an online doctor? What's that? How do you do that? How do you even think about that? How? And I was like, it is possible, to me it was so clear, but people were not ready. And now it seems like, oh my God, the land has been prepared for me. Let's go. Because it is it is happening. The hospitals will always be there, and of course we need them the same as we need certain medication, like we were saying the other day. But there are so many things that we can do through telemedicine that would actually give a lot of air and space and a breath to the healthcare systems, because then people won't have to go to the emergency room or to pay a consultation to ask for mild things that can be, solved over a phone talk or a video call with your doctor. Because most of the times, those are mild things, right? Unless something then is advised, or there is pain, really bad pain involved, or even you don't know where to go. So the teledoctor can actually tell you, okay, what you're explaining to me sounds like, abdominal pain on the right side is suspicious, then maybe better go get checked, instead,
Yeah.
because it happens so many times. So telemedicine is really opening up the possibilities for us as healthcare providers, and for people to make it easier, and to avoid collapsing the system. And to me, has always been like that. Like, I am the doctor that chose not to be in the hospital because I feel like if I am out of there doing this, I can help my colleagues in the hospital not be collapsed, you know?
Yes. Yes. I absolutely love that you're saying that, because as I'm reflecting on my own life again, so I'm remembering my older daughter, she's 10 now. And so her pediatrician, we had each other on WhatsApp. And so whenever she's facing something as a baby, I would like message him. I'm like, okay, this is what's happening with her. It's my first child. You want to get it right. You're messaging him and you're like, can I see you, and can I like bring her and let whatever it is, we'll figure it out. And sometimes he would just resolve the entire thing right there in two text messages. He would
Yeah.
be, well, if based on the hours and the time and her temperature and whatever, he would prescribe all the things. He knew what I already have as medication for her. He's like, oh, you got that, just do this. And so he would do it so naturally and instantly and easily.
I
And
love
so I
it.
would say to him, but I'm not getting to pay you. Like, if I come there, I get to pay the consultation fee. Like, at some point I started to be concerned about him. Like, how are you even going to make a living here? I'm not getting a chance to pay you, and you're giving me all these,
Yeah.
beautiful information and supporting me so well. And it took me a while to realize that that was not his first priority, because he was happy that I didn't have to wait in a line.
Yeah.
He needed to get himself to the office. And then we had to go through all these systems and for the simple thing that he could have solved right there. And
Yeah.
instead, his time was better spent if he was lecturing the other doctors to impart this knowledge to them, because he had such a high position. And he would spend his time there, or if he was doing any kind of surgery kind of things, because he was always also there. And yes, he wanted to ensure that the babies were good, and yes, he will see them occasionally, but if it is that he can resolve much of this from a simple text message, he would choose that, and it was
Yeah.
so beautiful. I felt so supported. It was, even when I got over here in the US, I'm still
Support. Yeah.
messaging my doctor in South America to be like, hey, can you just like help me here, because I'm not getting the support I'm accustomed to in these things, right? And he would
Yeah.
happily do it, because it so happened as well for this particular doctor, his kids and my daughter also ended up in the same class, not only in the same school,
Ah,
but in the same
yeah.
class. So then there's a deeper bond with friendship and connection and all of that.
Yeah.
And if anybody asks me which pediatrician, or 5 years later somebody is getting a baby, I'm like, he's a doctor, right? And so
You
even
go
though
to him.
it didn't seem like he was getting paid from me initially, because of his natural state of being and how he is, he has so much recommendation and support, and
Yeah.
from the
Mhm.
community and everybody else, right? So
Yeah.
it's really beautiful,
I
and this
love
is
it.
what I know. I know you've got a huge heart, and you've always been there and supporting a lot of people, and it's so good to have that kind of relationship, right, with your doctor. It's more than
Hmm.
just, oh, I'm sick,
Yeah.
help me, save me, and then after that,
Nothing.
they
Like
disappear.
doctors before, like doctors would go to the house with their little black bag and they would be offered coffee or whatever. I mean, I'm happy even to do that if. But it's that concept. Like maybe we don't have to go to the house and have coffee, but maybe we can have this Zoom consultation, for example, and we get to talk and we get to to ease. I ease you and I ease my time, like you said it for this doctor. You probably felt like you were not paying him, but from my viewpoint, you both were saving time, money. You were not, spending gas to get there, and same for him. And he was using that time wisely as well, doing other things for growth. It really helps everybody, and
Yes.
most of the times, it's possible. It's more likely than not that these small consultations are usually cleared, through a small call or a WhatsApp. How many tools we have these days now that allow us that? I came to Spain 10 years ago, WhatsApp didn't exist. It has
Yep.
changed in such a short time, you
Yes.
know. So I
Exactly.
want to take advantage of these. I want to help to that, and I know many other people are trying and looking for it.
Right. And so
Yeah.
the things that has happened as a result here with him, I also see that you're doing that as well, where because of his taking the time with me in that way, now he has empowered me with certain basic knowledge. So if these symptoms happen again with my children, I don't need to text him. I know what to do. I'll do the first set of things. And if it doesn't work, I'm like, okay, I did. When I'm messaging him now, I'm like, okay, this happened. I did this, like you recommended the last time. This is what happened, and here we are,
Yeah.
right? So now
I
he
would
gets
feel
to do the
proud
other
as a
piece.
doctor. If a patient tells me that, I would feel, like mission accomplished. Perfect. Of course.
Yes, right? And it's so beautiful. Um, because now he only has to do his part of it, and it's interesting because I do pay attention. I do show up as a learner, as a learner in the office with the doctor. So I would already do the diagnostic work for them, and I'm like, okay, this is the stuff, you do the other part. What's the prescription here, and they would find so much joy in that, because we're already cutting down office time. I'm like, no, we don't need to go through all the drama, all the things. If you need to
Yeah.
do a test to confirm what I'm saying, do what you need to do. But here I am, right? And it's
Yeah.
so much fun to have this sort of conversation with my doctors, regardless if
It's
it was the
so joyful.
gynecologist or whoever else, in that field. So I want to
Yeah.
read quickly what Lewis is saying.
Yeah.
So she says, Mariana, I
Thank you,
love
Luis.
that you're expanding the definition of a traditional doctor. Woohoo,
Thank
progress for the world. And then she says, our provincial health care system authorized phone consultations through the healthcare billing system when COVID started. So that's progress. So great. So now, there is a payment system if you're doing these kind
yeah,
of consultations as well. So, we can all do this. And
yeah.
and I see
The
it.
world has adapted, and there's proof.
Yeah,
Sorry,
I see
go.
this where, no, that's okay. Where when you're empowering all of us, there's so many people on the planet. It's not like, oh, well, if I give this information that I spent all my years studying and all of that, some lack and mindset story. You're more like, here's the thing, do the thing, be healthy. And then if you still need, after you cover the basics, if you still need help, I'm here to
I'm
take you through.
here.
Right, for the other part of it, but this
Yeah,
part you got it, and empower your kids, empower your family, and it's such a beautiful message. So I'm glad that
yeah.
I've experienced
I
this
love it.
before, and I get to experience this even more with you.
Thank
So
you.
thank you. Yes.
Same, same. Because I really, I tell you, as a doctor, it's a joy. It's really a joy to feel these things, to read these messages, to read, to have the feedback in itself. It
Yes.
doesn't matter, if it was a small thing or whatever. It never is as small that is not important. It always is, and it's always like yes. So thank you.
Yes. That's beautiful. So I want to close with a last point, which,
Mm,
again, Marianne and I are so in tune. So before I got on this call, one of the things I was doing was taking the time and sitting down to type an email to the principal of the elementary school that my daughter is going to, because they did such a beautiful, heartwarming farewell, even though we, had supposed to wear masks and can't touch each other. It was so much love. And I thought
mm,
about even the fact that I felt it and I was so moved by it. And yes, I'm telling people around me, but they may not hear about it unless I make the conscious effort to say it to them. So today I sat down and I typed out that email and thanked each teacher and
oh
showed them
wow.
what it did and how it impacted us and why it impacted us and our background and all of that, so that they see the whole picture, so that they can really appreciate how I was feeling about it. And and so this is, I'm saying this because, again,
Wonderful.
as a doctor, you make so many changes, and so you're such an impact on people's lives, but people get busy after they get better. It's like we have this saying that sometimes when we're sick, we remember to pray to God, and when when we're healthy, we get busy and we forget. It's that kind of thing.
Yeah.
And I really
Mm.
believe now is the time to change that kind of pattern. So for all of you, if whatever you've uh, been receiving here, and however it's helped you, no matter how tiny it is or how big it is, it's always so good to take a moment to thank that person, because everybody's been guided to do this kind of thing. And sometimes when there is no feedback, we may judge ourselves and be like, oh, maybe I'm
Mm.
not needed, or maybe I'm doing it to the wrong
Maybe it's not
audience, or
helpful.
yes, I'm not being helpful, I'm not making a difference, and maybe I should quit this kind of job and do something else. Sometimes they can do that kind of thing. So
Yeah, yeah, it's true. Mm.
so I think our
Yeah,
little,
gratitude.
yes, our little love notes goes a long way. So if it is that you have as you hear this, whoever comes to mind, to send a love note to, take the opportunity and do it.
Wonderful. I love it. Love notes. Hmm.
Yes.
It sounds like a project idea.
I love that I'm lighting up your mind. Beautiful. So thank you for
Yay.
being here
Oh, thank
today.
you. Yeah, I feel complete. This was fun.
Of course, always a pleasure. All right, loves. Thank you. Have an amazing day, evening. See you all later.
You too. Thank you all. See you tomorrow.